You know that feeling when you get a new prescription? You look at the bottle, you see this long, complicated name, and you immediately start to wonder, what am I really putting in my body? It's a totally normal reaction, especially with meds that can affect how you feel. So today, we're going to get to the bottom of a really common question about the muscle relaxant methocarbamol. Is it a narcotic? So let's say your doctor prescribed you methocarbamol. Maybe you pulled something in your back, or you've got a nasty sprain. And that little voice in the back of your head starts whispering, hold on. Is this some kind of opioid? Is this a narcotic? It's a great question to ask, and you came to the right place for a clear answer. All right, let's not beat around the bush. The simple, direct answer is no. Methocarbamol is not a narcotic, so you can take a breath. But that just leads to the next question, right? If it's not a narcotic, why on earth do so many people think it is? And that's where we start to unpack the confusion. To really get why this question comes up so often, we have to look at how this medicine works, and maybe even more importantly, how it can make you feel. And this, right here, is the main culprit. The whole reason people get confused is because some of the side effects, like feeling drowsy or a bit dizzy, can sort of feel like what people think a narcotic high feels like. But let's be really clear. Feeling sleepy or lightheaded is not the same thing as the euphoric high that opioids are known for. Not even close. So, okay, if it's not a narcotic, then what in the world is it? And what's it actually supposed to be doing? Let's break down its real job. The official technical term is that methocarbamol is a central nervous system depressant, or CNS depressant for short. Basically, its job is to tell your nervous system to just chill out, to calm down, and by doing that, it helps relieve those tight, painful muscle spasms you get with an injury. It's not blocking pain signals all over your body like a narcotic does. It's targeting the muscle itself and telling it to relax. You can see the difference really clearly when you put them side by side. Methocarbamol, on one hand, is all about relieving specific muscle spasms. Narcotics, on the other hand, are for more generalized, widespread pain. And here's the big one. Methocarbamol does not give you that euphoric high. That leads us to the most critical difference of all. Its potential for addiction is low, whereas for narcotics, that risk is incredibly high. They're just in completely different leagues. So what kind of situation would lead your doctor to prescribe this? Well, it's almost always for short-term or acute muscle problems. Think about that time you lifted a heavy box the wrong way and strained your back, or a really bad sprained ankle, or even the muscle stiffness you might get around a fracture. It's designed to be a temporary fix for a temporary problem. Okay, now that we're clear on what it is and what it's for, let's talk about what you should actually expect to feel when you're taking it. The most common things you might notice are, you guessed it, dizziness and drowsiness. Those are the two we keep coming back to. But you might also feel a little lightheaded, have some blurred vision, maybe a headache, or even some nausea. For the most part, these are just signs your body is getting used to the medication. Knowing the side effects is one thing, but using this medication safely, that's a whole other level. And this is where we really need to pay attention, because what you mix with methocarbamol is absolutely critical. So what do you need to be careful of? What should you absolutely steer clear of? Taking this is about more than just remembering to take a pill. It's about being really mindful of what else you're putting into your body. Remember how we said it was a CNS depressant? Well, if you mix it with other things that are also CNS depressants, you're basically piling on the sedative effect. You're doubling down. And that can be a really dangerous combo. We're talking about things like alcohol, other prescription painkillers, even some over-the-counter cough and allergy medicines, sleeping pills, and anti-anxiety drugs. It's a long list, and it's important. And this has major real-world consequences. That compounded drowsiness and dizziness can seriously mess with your judgment and slow your reaction time way down. Getting behind the wheel of a car or trying to operate any kind of machinery becomes extremely dangerous, and that risk just skyrockets if you add alcohol or marijuana into the mix. All right, let's talk about the hard stuff. We're going to address the two biggest fears that pop up with a prescription like this: addiction and overdose. We need to be crystal clear about the facts here. So here's the most important takeaway on this topic. When you take methocarbamol exactly as your doctor tells you to, for a short-term issue, it is not considered addictive. The reason is simple. It doesn't create that high that makes people crave more, which is the very thing that fuels addiction. But, and this is a really big but, an overdose is possible. And that risk goes way, way up when it's mixed with other substances, especially alcohol or other sedatives. That combination can depress your central nervous system so much that it becomes a life-threatening emergency. So if you ever ever suspect that someone or even yourself has overdosed, there is absolutely no time to waste. You need to get emergency help immediately. Call 911 or the poison control hotline. Try to have key info ready, like the person's age, how much they might have taken, and anything else they might have mixed with it. Acting fast is everything.
Whew, that was a lot of information. So after all of that, what's the one thing you really need to remember? Let's boil it all down to the absolute bottom line.
This quote really just says it all, doesn't it? Methocarbamol isn't a narcotic. Unlike narcotics, methocarbamol isn't addictive. It's a muscle relaxant. That's it. It's a very specific tool for a very specific job. And when you use it the right way, under a doctor's care, it's a safe one.
So now you have the facts. You know what it is, what it isn't, and how to use it safely. And that's really powerful. This knowledge isn't just trivia. It's designed to help you have a smarter, more confident conversation with your doctor about your own health. So the only question left is, what's the next thing you're going to ask them?